Can you believe nowadays we can do non-invasive surgery? That means we can kill a tumor without even putting a needle through your skin. And this is the newest tool we have for treatment of cancer. It's called Histotripsy. It's a relatively new technology. It has been approved by the FDA for about 2 years. I know, it sounds like science fiction, Star Trek kind of stuff, but it's actually real and it's happening today. And I'm gonna walk you through how it works, the latest clinical data, and why it's changing how we treat liver tumors. Histotripsy is considered a revolutionary medical procedure that uses what's called a focused ultrasound that pulses through and mechanically breaks apart targeted tissue like tumors into microscopic debris. Unlike traditional treatments that rely on heat or chemicals, which you have seen some of my other videos of microwave ablation, radiofrequency ablation, or even cryoablation, histotripsy works through what's called acoustic cavitation. I'm going to walk you through. But as I see it, it works as a very focused sonic boom. We all heard about what a sonic boom is when like a plane is traveling above the speed of sound and it causes compression of the air, which causes that loud sound, right? So what's happening with this technology is that very small sound waves, which are called ultrasound, that we can't even hear, but they're actually sound waves, which are mechanical waves that travel through the tissues. And we focus that in the tumor. So, and the nice thing about this is although tumors cannot survive these sound waves, your normal tissues like blood vessels or bowel mucosa or bile ducts, they are more resistant to the sound waves and they will survive. So this technology can kill tumors while sparing your normal tissues, which is really exciting. Although other forms of ablation, like the microwave ablation, the cryoablation, although they can be very targeted, they will destroy everything into that area. So if you're going through a blood vessel or a bile duct, will destroy those. And that limits those technologies, because if you have a tumor that is located close to the bile duct, we just can't treat it. Who are good candidates? What tumors can be treated with this technology? Nowadays, the technology is only approved for liver tumors, which include not only primary liver tumors like hepatocellular carcinoma or cholangiocarcinoma, but also metastases, which are when other tumors migrate to the liver, and sometimes that can be the main problem to the patients. Sometimes patients that have colon cancer, for example, you actually remove the tumor in the colon, so that's cured, but they have liver metastases, which are the only place that they have tumor in the body. And sometimes we treat those with surgery, but when you have too many or they're in a difficult location or you already had surgery, certainly we need to look into other alternatives. And for those, we traditionally have been treating with ablation or Y90 or different things, but histotripsy is a new and great option for those as well. Histotripsy is also being studied for pancreatic tumors, kidney tumors, prostate tumors, and even brain tumors. And I think in the next few years, the applications of this technology are going to expand and maybe limitless. The tumors that are ideal to be treated for this are 3 centimeters or less, and also they need to be visible on an ultrasound. That's because the way that this is being done today, you can actually treat a 4 centimeter sphere at a time. So if you have a tumor that is more than 3 centimeters, it can be done, but may require more than one treatment at the same time, which is a doable option. It just takes a little bit more time. And the way the histotripsy works is you're putting a small amount of energy in a small area, which is usually a 0.5 centimeter round focal point. Then what makes the technology possible and makes us be able to treat larger tumors is that the technology is attached to a robotic arm. And that robotic arm will move precisely, treating like 0.5 centimeter at a time, and you can achieve essentially whatever size you want. Currently, it's only available for a round tissue of 4 centimeters. However, you can treat less than that if you want, if this tumor that we're treating is smaller, or you can treat more than that if we do more than one treatment at a time. But I can see in the future that because this is done by a robotic arm, you'll be able to program to treat whatever shape you want and whatever size you want, as long as it's safe for the patient. So now, who are not good candidates? Which are the patients that this technology is not suitable for? Currently, we cannot treat tumors that are deeper than 12 or 14 centimeters. It's just that the technology cannot penetrate that deep. But this is rare, but you can see that with very large patients and in a difficult location of the tumors. Also, the tumors need to be seen by ultrasound, like I mentioned before, and some tumors are not visible on ultrasound currently, and then we cannot treat them. But we are developing new technologies that allows us to fuse images from an MRI or a CT scan into the ultrasound machine so we can localize these lesions and treat it. Some lesions that are located close to the lungs, they may be difficult to treat because you can't see them very well with the ultrasound. And also, it's not that you would damage the lungs, but what the air in the lungs does is to prevent the energy from getting through and killing the tumor. But there are techniques we can use for those challenging cases. For example, we can partially collapse a lung just for the procedure, and then we will expand immediately after. That's something that can be done. Also, very large tumors, like I mentioned before, they are not ideal to be treated with this technology right now. And sometimes other options may be better, like surgery or a Y90 segmentectomy, which I have a whole separate video about it, and you can watch if you're interested. Another limitation of this technology is that it requires that the patient doesn't move at all during the treatment, which can take from 10 to 45 minutes. So nowadays, this is done with a general anesthesia. So patients that cannot tolerate general anesthesia cannot undergo this procedure. You're also interested to know what are the results. And I can tell you that this technology has been used for about 2 years, and there are over 1,700 cases done in the United States. And so far, the technical success rate, which is be able to actually do what you are planning to do, like burn that specific tumor, is about 96%. So it's very high. So we're able to do this. Also, the local control, which means like make sure that this tumor is still dead a year after the treatment, is about 90%. Of course, this data is for tumors that are 3 centimeters or less. The results are not the same if your tumor is larger, but for those tumors, we have excellent results with this technology. Essentially, 9 out of 10 tumors treated with histotripsy did not come back in the same area. That also, for patients with metastasis, doesn't mean that another tumor may not come back in a different area, but then that can be treated with this or something else as well if that happens. But the tumor that was treated should not come back. Now let's talk about what are the steps and how do we actually do these procedures. So the first step is we need to see the patient in the office. And at that time, we'll review all the images, review the whole case with the patient. And most importantly, we'll also do a real-time ultrasound that we perform in the office to determine if those tumors are treatable. So we need to be able to see them in a reliable fashion, and we need to see if the angulation and depth are suitable for the technology. Once we determine the tumor is treatable, then we will schedule the procedure in a hospital. We currently are taking our patients to a hospital to get this procedure done, although the procedure is completely an outpatient procedure, so you go home the same day after the procedure. Like I mentioned before, the procedure is done with a general anesthesia, and it can take from 1 to 2 hours depending on how many tumors and the size and location of the tumors that we are treating. Once the patient is under anesthesia, we'll position the patient in a suitable way, like the best way that we can reach the tumor, and we can easily visualize the tumor. Once we turn on the machine, at that point, we're just watching, make sure things are going okay, and the machine is doing all the work, and that can take anywhere from 10 to 45 minutes depending on the size of the tumor. Most of the time, if you need additional treatments, if we're treating more than one tumor, for example, we need to reposition the machine and find the next tumor and prepare and plan, and then turn on the machine again and repeat the process. And like I said before, the procedure itself is not a painful procedure, and the only reason that we place the patients under anesthesia is so they don't move, because if they move even a centimeter or two, that will change completely the treatment zone. So we have to keep them still, so we keep them under general anesthesia. After the procedure, the patients recover for about an hour and then they go home in the same day. And what to expect after the procedure? Most patients have some pain at the procedure site, which is natural since you're actually destroying tissue. But the pain usually subsides within a few days. Some patients can develop a fever after the procedure, which is essentially a normal body reaction to tumor destruction. Like if we destroy tumors with any method, like ablation, embolizations, and things like that, it's common to have fever for a few days, usually a low-grade fever and resolves on its own. Usually responds really well to anti-inflammatories like ibuprofen and naproxen, if you can take those. But patients can essentially resume their normal activities as there is no healing time in terms of skin incisions or punctures. And also the risk of bleeding with these procedures is essentially almost zero. So the nice thing is it can be done even on patients on blood thinners. Now, some patients may develop some irritation of the skin, or in more severe cases, even some blisters or a bruise in the area. And that's usually related to the energy going through the skin, especially if we're treating over ribs, because that requires more energy to get the tumor. What are the possible risks of the procedure? While histotripsy is considered a very safe procedure, nothing is risk-free. No procedure and no medication is actually risk-free. So potential risks include, like I mentioned before, some soreness and discomfort at the site, some bruising or blisters in the skin, and an inflammatory response to your body, like I mentioned before. So patients can develop some fatigue, some low-grade fever, which eventually resolve in a week or two. Now, I also mentioned before that damage to nearby organs is really rare, but it's not impossible, and we will have to watch for that if your tumor is close to an organ. But it's really rare because, like I mentioned before, your normal tissues are more resistant to this technology than the tumors are. There's another small risk with these procedures is if they are located close to what's called the portal vein, which is a vein that is feeding the liver. In those cases, there is a small risk of having a portal vein thrombosis, a blood clot within that vein. Now, that blood clot is not a dangerous clot in the sense that it cannot go to the lungs or to the brains or any other organ, but we don't like blood clots. And in some cases, we may use a blood thinner to prevent the clots. And we'll let you know if that's the case. There are a lot of benefits of histotripsy compared to the traditional treatments. The most obvious one is that it's completely non-invasive. There's no incisions, no needles, and essentially no risk of bleeding. There's also no heat damage or cold damage to the surrounding tissues. There's minimal recovery time. Most patients return to their normal activities within a day or two. There is one additional benefit that we haven't talked before, but there is a potential to activate this immune system to attack the tumor cells. Now, this is what's called an abscopal effect. And some doctors believe that it can happen in up to 10% of the cases. And that means that you treat one tumor in the liver, let's say, and all the other tumors start getting better. Now, this is still being studied, but if that really works, it would be an amazing thing. And also, these treatments can be repeated as many times as necessary in the same area or in a different area in the liver. Although we think the technology really works, it's still undergoing clinical trials for different types of tumor, including pancreatic tumors and lung lesions. And we're also exploring how it can be combined with immunotherapy and other treatments to amplify the body's natural defense against these types of cancer. Now, if you or somebody you know are exploring new non-invasive treatment options for cancer, histotripsy might be worth considering. And you can always let us know if you're interested, and we may be able to help answering some questions. Of course, always consult with your medical team to see if you're a good candidate and if this may be an option for you. And if you're interested in minimally invasive options for treatment of cancer by interventional radiologists, you can also look some of my other videos about Y90, chemoembolization, microwave ablation, and cryoablation.